Hello and welcome. And today I'm very pleased to introduce Dr. Adam Barsouk, who has written a book called Outsmarting Cancer, which I have to say I think is a really actually neat title. And I think it really goes very well based on the premise that the book is about, you believe 50% of all cancers are preventable. So welcome, Adam.
It's a pleasure to be here.
So, do you want to quickly give a quick intro of who you are and where you're from?
Absolutely. I'm an oncology fellow at Hopkins University in Baltimore in the United States. But I've been involved in cancer research and working with cancer patients for decades now. I first got involved in high school when I was when I lost my grandparents to rare hematologic malignancies. And their loss inspired me to get involved first in cancer research, and now I'm working with cancer patients as a physician. And I learned from their cases that they likely were exposed to radiation from the Chernobyl nuclear accident back in Ukraine, where my family originally is from, and that may be what led to their rare blood cancers. And they opened that their cases opened my eyes to a vast number of preventable cancer cases that are here around the world. Really, how often, as many as 50%, as you said, people who are diagnosed with cancer, there may be a risk factor that we are not aware of, whether it be in our environment, our food, the where we work, the air and water that we're exposed to. All these things affect our cancer risk. And the more I've worked with patients in the clinic, in the laboratory, the more I've realized how important it is to get the word out there, because it is something that we really don't speak and learn and talk about very frequently.
Yeah, I think it's interesting you use the word learn because it's not learning just from the patient side of it, it's learning for doctors. And I think in your book, you quote, you do it the wrong way round. You look at, okay, how do you treat the symptoms and the issues with cancer? And the prevention is the last thing that you even look at.
Exactly. I think I think we, for the longest time in medicine, we've been very, as you said, symptom oriented, right? Problem, solution. We are reactive in our philosophy and our approach to treating patients. And the truth is, even the research, we really hadn't been doing outside of, the obvious things. People have been looking at smoking for decades now, but we really hadn't been investing the funding and putting the effort into understanding all the other environmental exposures that increase and lead to cancer risk. And I think a large ideology of that is that the truth is there really isn't much money in prevention, at least not in the short term, right? I think medicine, the oncology industry is very lucrative. There are billions of dollars to be made in pharmaceuticals and new immunotherapies, targeted therapies for treating cancer. But there's no incentive for any individual or corporation or anyone to really make any money from preventing cancer, right? It saves all of us as a society billions and trillions of years down the line. But unfortunately, administrators and politicians are often very short-sighted, right? They're not looking at the effects that any intervention may have 10, 15, 20 years down the line. And because of that, we've only invested something like 5% of healthcare expenditures into prevention, when we're seeing that prevention can account for 50% of all cancer cases.
I mean, it's shocking, really, and I mean that's quite a damning statement from you on the industry, really. But I completely understand it. So let's start talking about preventative. What are the easy things that we can do? And I know a lot of these are going to be very obvious to people, but
Yeah, I think a lot of the things that we know are healthy seem obvious and seem like common sense. But I think what is new to a lot of folks is thinking of them as preventing cancer, right? We've known for the longest time that healthy diet, exercise, these are good for your heart, these are good for preventing heart attacks and strokes. But the truth is, all the same things are also incredibly intertwined with cancer risk. It remains that the number one leading cause of cancer around the world remains smoking, as I'm sure everyone is aware of and has heard of. But number two at this point is obesity. In fact, excess body weight, it causes inflammation. It sends your immune system into overdrive, causing it to attack its own cells. And being overweight or obese is associated with nearly every cancer type out there. Breast, colorectal, stomach, lung, all of these, you're at heightened risk if you have excess body fat. And on top of that, right, there's alcohol, which I think most folks know is not great for us, but it is the leading cause of liver cancer around the world. It contributes to stomach cancer. It's a huge burden for liver health in general. And on top of that, right, then there's all these other exposures that we have in our water, in the air. Air pollution is incredibly common in the developed world, especially for those of us living in cities with lots of cars, with lots of factories, right? And there's the foods we eat outside of just obesity. It's specifically the ultra processed foods that are chock full of preservatives and all these chemicals that haven't been tested, as well as red meats, processed meats, right? There are many different food groups that themselves have been linked to cancer risk. So all that goes to say that there are innumerable everyday exposures that we all have that can affect our cancer risk, either increase it or decrease it. And while it's impossible to avoid all of these things, the more we're aware of them, the more we can make small changes in our day-to-day lives to try and minimize our exposure.
And I know that you didn't cover this in the book, but I would be very interested to know where do you think the responsibility lies? Is it ultimately the patient and, we need to look after our own health, or is it our governments or industry in the sense of the food industry or the tobacco industry taking more responsibility because they know there is the evidence there of how harmful it is? Where do we start to try to correct it?
Exactly. I think what I did delve into that somewhat, but I think it's important to keep in mind, right? Everything in life is is a balance. And there's definitely a component of individual responsibility and choices to all this, right? We all are the product of the choices we make on a day-to-day level. But the truth is that in many ways, the modern day world is stacked against us, right? The odds make it very challenging for any individual person to kind of get through their day, and increasingly so, without being exposed to so many cancer causing or cancer promoting exposures. And you think about, for instance, the tobacco industry in the 1950s, 60s, 70s. I go into this in my book. They basically engaged in predatory advertising to get people to be convinced that cigarettes were safe, that they were actually recommended by doctors, that to kind of quell the early fears of them causing lung cancer. And I think we're seeing very similar things from other industries these days, right? There's so much focus from various food companies trying to portray themselves as indubitably the healthiest product out there, even though their products are full of chemicals that are unproven preservatives, right? Even though there's increasing data about these processed foods being linked with cancer risk, heart disease risk, and so forth. And that's just one example, right? The modern day world makes it very difficult to live this perfect, like healthful, optimal, healthy lifestyle. We have increasing stress, which we know in and of itself increases cancer risk, increases risk of everything. But the amount that we are working is far higher than in years prior, especially in the US. The people have limited access to health insurance. People have limited access to preventative care, latest cancer therapeutics that they come with hefty price tags that people can't afford. So I think there's disparities between races, between income brackets, right? So I think there are unfortunately an overwhelming number of societal issues that kind of predispose people, especially those at low means, low income, low education, to having increased cancer risk. And so while part of the story is educating individual people to make the right choices, the other part, which is equally, if not more important, is putting pressure on our politicians, on our legislators, to introduce regulations into the kind of foods that we eat, to try and decrease the amount of processed food in our diet, to make sure our air and water are held to high standards, sure that our health system is accessible to everyone and gives everyone access to prevention and encourages people to pursue those preventative measures.
And, one of the things, and we touched upon it at the very beginning, is your claim that, you're seeing cancer appearing in younger and younger people. What's the reason behind that? Is that based on some of the things you've just suggested now as to being why it is becoming more prolific in younger people?
Exactly. It's certainly multifactorial, but as you say, something like the rate of cancer in patients under 50, which used to be incredibly low, has now more than doubled in the last 30 years. So we've seen this huge proliferation of cancers in young adults. They're the group with the fastest growing diagnoses. And it's really not entirely clear right now what's the culprit, what's at the root of it. One aspect that has definitely been elucidated and implicated is obesity. Right, we know that young people more than ever now are overweight and obese. In America, the rate here is something like 70%. I think in the UK it's around 60%. But everyone's struggling with excess body weight, and that's certainly increasing the cases. But that's not everything, right? I've had people in my clinic in their 30s and their 40s who are in the prime of their lives, right? As healthy as possible. They're marathon runners. And they're still falling ill with these cancers that previously were thought of only in 60-year-olds and 70-year-olds. So there's something more to the story. And I think that's where all these other kind of emerging risk factors that we're only now learning about are really having the greatest effect. It's the ultra processed foods, it's the environmental exposures, right? One of the things I didn't mention is not just your typical chemicals and exposures in the water, but microplastics, right? It's something that we're all talking about now, but we've been putting these plastic particles into our water supply for the last 30, 40 years, not giving it a second thought. And now we're just realizing the amount to which they've accumulated in all of us, right? The average person has something like a water bottle's worth of plastic in their body at this point. And it's ubiquitous. It's almost impossible to avoid, but we know that it's linked with an increasing number of chronic diseases, including cancer risk. So there's so many things I think that are kind of collaborating against us, causing young folks to get cancer more. And that's why it's more important than ever now to be aware of these risk factors and try and mitigate them.
Yeah, I mean, it's almost overwhelming, but I think what isn't overwhelming is how you set it out in your book, which is very clear and allows you to see, the things that you can do to be preventative, to give, I think we always say these things. It doesn't mean that you are not going to get cancer. It just lowers your risk. And I was really interested reading, I don't know, I put some yellow little stickers here to prove I had actually read it. But there was a really good table, and I bet I won't be able to find it now, about, the risk of getting, your risk factor of getting cancer. And then I just found it shocking. The biggest one, as you mentioned, was the smoking. Um, and also chewing tobacco. And I don't know how many people chew tobacco or if that's something that's more of a cultural thing, but 48% chance, your 48% more risk factor of getting cancer, down to the next one, which you mentioned was obesity, which is sort of lying at 19, which sounds minimal compared to the smoking one. But obviously 19% is nearly 20%. So it's still a high risk factor. And then obviously we have the other ones moving forward. Um, I think the other thing that was quite interesting I found was talking about the getting cancer from infections. And you don't normally necessarily think about it like that, but clearly there's a lot of infections that can lead on to that.
Exactly. I think so. That table explains kind of the attributable risk of all cancers that we can find a root cause for. What is that root cause? And as you explained, it's about 50% of all cancers around the world these days are due to smoking. Less so here in the developed world. Obesity, around the world is something like a fifth, but here in the U.S. or in the U.K. might be more like a third of all cancer cases can be attributed back to obesity. And once it's never one clear thing. And same with these infections, which people often don't think about, right? It's once again, it's never one specific inciting factor that we can prove caused a cancer, But there are a number of infections that significantly increase your risk. The most common and the one that I think everyone's aware of, is HIV, right? Which causes the AIDS virus. HIV is associated with a number of different cancers because it suppresses your immune system. So it increases your risk of a certain kind of skin cancer, lymphoma, leukemia, right? But the silver lining there, we have incredibly effective drugs now. So for folks who have HIV, as long as you're taking the medicines regularly, your cancer risk is almost the same as everyone else. And for the rest of us, right, uh, the other big sexually transmitted illness that's associated with cancer is HPV, human papillomavirus, which is a cause of genital warts or warts around the body. But certain strains of it actually cause those warts to grow further and become squamous cell carcinoma, cancer of the cervix, of the anus, of the head and neck and mouth, right? And once again, thankfully, with this virus, we now have an incredibly effective preventative treatment for it. It's the vaccine that if children get at the appropriate age, at 11, 12, 13, when their immune system's first developing, you can nearly prevent all cases of this cancer-causing virus. It reduces it by something like 98, 99%. So it's highly effective. If everyone in the world were to get this vaccine when they're supposed to, we could basically eliminate these specific cancers, right? So it's the story of infectious disease causing cancer is an incredibly old one, right? Some of the earliest cancers documented were due to bacteria and viruses, but it's also a huge success story. It's an area where we've had incredible strides in prevention, and I think unfortunately, nowadays there's a lot of vaccine hesitancy and a lot of mistrust in this area, which makes it more difficult to achieve those outcomes to be able to fully prevent the cancers. But it's something that's so important that people are aware how much we've really improved human existence in day lives with our incredible advances against these viruses and bacteria in the developed world, and how much they still are an issue in the developing world.
Yeah, I remember when the results came out for those vaccines for young children, which was, and it really wasn't that long ago. It was only, it feels like 2 or 3 years ago. And just thinking, wow, that is impressive. It's, we're not talking marginal 10, 20%. We're talking, high 90%. And that is phenomenal. And for people to dispute that because it's a vaccine, it just is mind blowing. They don't realize how good some sections of medical care has improved radically over the years. Moving on though, to, talking about one of the things that you cover is stigma. And I think stigma is really important. And the one that always springs to mind would always be lung cancer, and the stigma and the shame of saying people, I know people who've said it, of having lung cancer and, they've never smoked. Likewise, similar to liver issues, it doesn't mean they're an alcoholic. And I think there's a lot of things that we need to get over in our society about the stigma of having certain diseases.
Exactly. I think much like the stigma associated with against vaccines these days, so much of medicine is the social aspects of it. It's that interplay between our societal and cultural expectations and the diseases that have very strict, rigid, objective, scientific data behind them as to how to diagnose and treat them. Right. And one of the areas where it really comes to a head is where you have these cancers that people know are associated with a certain risk factor, and there's almost this degree of blame against the patients, right? So many of my lung cancer patients, to your point now, increasingly are non-smokers, and yet there remains this kind of overarching philosophy: oh, lung cancer, it's people did this to themselves. It's just for smokers. And because of that, we see that cancers like lung, like liver, they actually have significantly less investment in research than something like breast cancer, because I think in part because people associate them with the stigma, right? People, there's still that degree of it's not going to be me because I didn't smoke. It's only for smokers, so I'm less worried about it, right? It's not something that I have less sympathy for these patients, and I think that's incredibly unfair, even to people who did smoke or did drink alcohol or did use drugs, because the truth is that these for the most part are not just choices. right? Addiction is a medical disease. It's not something you can control. And like we've already discussed, right, things like tobacco, alcohol, they've been over the years aggressively marketed to people, right? There's been predatory marketing to try and get people to try them, especially people with low education, low income. And once you do try it, it's nearly impossible to quit. To cigarettes, tobacco, nicotine, these are some of the most addictive substances on earth. So it's incredibly not fair to blame people for ending up addicted, for using tobacco, for drinking alcohol. I think instead we ought to be putting our focus towards changing societal infrastructure, right? Decreasing or eliminating advertising for things like cigarettes and alcohol, investing more in helping people overcome their addictions, and investing more in public health education so people are aware of how bad these substances really are for them, instead of kind of entirely trying to dump it all on the individual and saying that it's entirely their choice to have made bad choices and now end up in a very unfortunate situation with an unfortunate diagnosis.
And I think actually that leads the conversation to being totally full circle because it's all about preventative health. And how do you do that? You do that at an individual level, and then you do that at an economy, country-wide level. And, globally would be great, but that's obviously never going to be possible on the basis that, the economics or the way countries work and regions are very significantly throughout. So, Adam, I'd like to say thank you so much for your time. And another quick plug for the book, Outstanding Cancer. No, Outsmarting Cancer for sure. Thank you, Adam.
Absolutely. It was my pleasure to be here.